How to take care of your 80-year-old elderly parents at home, Part 1. Do's and don'ts of taking care of the elderly. Before I even heard about this topic, I had a small stint seeing the elderly being taken care of or taking care of the elderly at some point. My main concern then was, and still is, are the elderly at home being taken care of in the right and correct way? Especially those without a trained caregiver. The concern became greater, so I decided to spend time with others to learn more about this task of caring for the elderly. Caring for elderly parents, especially when they are sick, is a responsibility that requires patience, compassion, and knowledge. Aging brings various health challenges, and ensuring the well-being of an 80-year-old parent at home requires a well-structured approach. Here is an outline of the essential do's and don'ts to help caregivers provide the best possible care while maintaining their well-being. Dose. Regular doctor visits and adherence to prescribed medications are crucial. Keep a detailed record of their medical history, medications, and any allergies. It may be beneficial to consult a geriatric specialist for tailored healthcare advice. Eliminate fall hazards by installing grab bars in bathrooms, using non-slip mats, and ensuring good lighting. Arrange furniture to allow easy movement and ensure they have a comfortable, easily accessible sleeping area. Provide well-balanced meals that cater to their dietary needs. Encourage hydration and consult a nutritionist if necessary to ensure they are getting essential nutrients while managing conditions like diabetes or high blood pressure. Gentle exercises such as walking, stretching, or chair yoga can help maintain mobility. Engage them in mental activities such as reading, puzzles, or conversations to keep their mind active and reduce cognitive decline. Loneliness and depression are common among the elderly. Spend quality time with them, involve them in family activities, and ensure they feel valued and heard. Encouraging social interactions, whether in person or through virtual means, can also improve their mood. If their condition worsens, consider hiring a nurse or caregiver to assist with daily activities. Hospice or palliative care might be necessary for those with terminal illnesses to ensure they remain comfortable. Taking care of a sick elderly parent can be physically and emotionally draining. Caregivers should ensure they get enough rest, seek support from family or professional groups, and take time for themselves to avoid burning out. Don'ts. Do not ignore their health concerns. Even minor symptoms should not be overlooked, as they can escalate quickly. Immediate medical attention for new or worsening symptoms is crucial. 1. Do not force them into uncomfortable situations. Respect their independence and preferences. Avoid pushing them into activities they are not comfortable with, whether it is eating a particular food or participating in an event. 2. Do not neglect their mental health. Emotional well-being is just as important as physical health. Do not dismiss their feelings, and be mindful of signs of depression, anxiety, or confusion, seeking professional help if needed. 3. Do not overlook legal and financial planning. Ensure all necessary legal documents, such as wills, power of attorney, and advance directives, are in place. Avoid postponing financial and legal discussions, as they are essential for future planning. 4. Do not hesitate to ask for help. Caring for an elderly sick parent can be overwhelming. Do not try to manage everything alone. Seek help from other family members, support groups, or professional caregivers to share responsibilities. 5. Do not disregard personal boundaries. While caregiving requires close attention, allow them to maintain their dignity and personal space. Avoid treating them like children and respect their decisions whenever possible. 6. Do not use harsh language or display frustration. Being a caregiver can be stressful, but patience is key. Avoid yelling or showing frustration as it can affect their emotional health and create unnecessary stress. 7. Feeding an elderly parent who is unable to feed themselves requires patience, dignity, and attention to their specific needs. Here is how to do it properly. Do's and don'ts when feeding. 8. Check dietary restrictions. Ensure their meals align with their medical conditions, e.g., diabetes, dysphagia, or heart disease. 9. Create a comfortable eating environment. Sit them up in a well-supported position, preferably at a 90-degree angle, to prevent choking. 10. Use adaptive utensils. If needed, special cups, spoons, and plates can help if they have limited movement. 11. Ensure the right food texture. Depending on their ability to chew, swallow, food may need to be chopped, mashed, or pureed. The feeding process. 12. Encourage independence first. Let them try if they can hold a spoon or cup with assistance. 13. Use small bites and slow feeding. Give a small spoonful and allow them to chew and swallow before the next bite. 14. Watch for swallowing difficulties, dysphagia. If they cough, clear their throat excessively, or struggle to swallow, stop and assess. A speech therapist may recommend thickened liquids or modified food textures. 15. Keep talking and engaging. Make mealtime pleasant by talking to them, as social interaction can improve appetite. 16. Wipe mouth gently. Keep them clean and comfortable while feeding. Post-feeding care. 17. Keep upright for 30-60 minutes to prevent aspiration, food going into the lungs. 18. Clean their mouth and hands to prevent infections. 19. Monitor for signs of malnutrition or dehydration, weight loss, dry mouth, or fatigue. What to avoid. 20. Do not rush feeding. It increases the risk of choking. 21. Avoid force feeding. If they refuse food, try again later, or offer different textures, flavors. 22. Do not lie them flat while eating or drinking. This can cause aspiration pneumonia. If you find this information valuable, do not forget to like, comment, and subscribe to our channel for more insightful content. Share your thoughts and experiences in the comments below. Until next time, stay healthy and connected for part 11 of this video.